How is fetal heartbeat absence diagnosed?
Hello everyone. Welcome back to our channel. Today, we will be discussing an important topic related to pregnancy: how fetal heartbeat absence is diagnosed. Fetal heartbeat absence can be a cause for concern during pregnancy, and it's crucial to understand how healthcare providers diagnose this condition. So, let's dive right into it.
What is fetal heartbeat absence?
Before we discuss the diagnosis, let's briefly understand what fetal heartbeat absence means. Fetal heartbeat absence, also known as fetal demise, refers to the loss of a fetus's heartbeat before delivery. This can occur at any stage of pregnancy and is typically a distressing event for expectant parents. It is important to note that fetal heartbeat absence should be diagnosed by a healthcare professional using appropriate medical equipment and techniques.
Physical examination and history.
When a pregnant woman visits her healthcare provider with concerns about fetal movement or other potential issues, the healthcare provider will typically begin the diagnostic process by conducting a physical examination and taking a thorough medical history. The healthcare provider will ask about any symptoms the expectant mother has experienced, such as decreased fetal movement or vaginal bleeding.
Ultrasound examination.
One of the primary methods used to diagnose fetal heartbeat absence is through an ultrasound examination. Ultrasound technology uses sound waves to create images of the fetus, allowing healthcare providers to visualize various aspects of the pregnancy, including the fetal heartbeat. During an ultrasound, a transducer is applied to the mother's abdomen or inserted vaginally to capture the fetal images.
Confirmation and repeat scans.
If the initial ultrasound examination suggests the absence of a fetal heartbeat, the healthcare provider will typically take steps to confirm the diagnosis. This may involve conducting a repeat ultrasound scan on a different day to ensure accuracy. The repeat scan helps to minimize the possibility of a misdiagnosis due to factors such as suboptimal positioning or technical difficulties during the initial examination.
Additional diagnostic techniques.
In some cases, healthcare providers may use additional diagnostic techniques to confirm the absence of a fetal heartbeat. These techniques may include Doppler ultrasound, which uses sound waves to assess blood flow in the fetus, or electronic fetal monitoring, which records the electrical activity of the fetal heart. These methods help to provide a comprehensive evaluation of the fetal condition. In conclusion, the diagnosis of fetal heartbeat absence involves a combination of physical examination, medical history, and imaging techniques such as ultrasound. It is essential for expectant parents to seek prompt medical attention if they have concerns about fetal movement or suspect any issues during pregnancy. Remember, if you have any questions or concerns, always consult with your healthcare provider for accurate diagnosis and appropriate guidance. Thank you for watching today's video. If you found this information helpful, please give us a thumbs up and don't forget to subscribe to our channel for more educational content. Take care, and we'll see you in the next video.